Hi, and welcome back. In this section of the course, I will talk about the promise of social media for translation of your work. One of the goals of the IRL program, and in fact, all of the Robert Wood Johnson Foundation initiatives around culture of health and leadership, is for fellows to use social media strategically as one component of your multi-pronged efforts to have impact and action resulting from your work. In this segment, I'll discuss two different and complementary ways that social media can be leveraged for translation goals. These are not exhaustive, but I'm going to focus on the first, which is using social media to leverage existing power structures. Essentially, using media to connect with those who already have power in the mass media, opinion leaders, policymakers, and their staff. The second way social media can be used relies on the participatory and democratic nature of social media forums like Twitter, and involves empowering and elevating voices that are not typically heard. So, why do we think social media might have promise in translation of research? Well, first, it's relatively low cost. Twitter, Facebook, they're free services. They don't take a huge amount of time. But I want to emphasize that that's not the same thing as being cost-free or free of time, of course, because it takes a lot of time to use social media wisely and strategically. But I would argue that that time can be well spent because social media can be more timely than other types of dissemination. You can have a paper or a report that was published 6 years ago, but if it becomes relevant to the policy discourse, if a policy window opens up, you can use social media, such as Twitter, to tweet about it, include a link, write a social media post, and hopefully garner more attention to your work, even if that work itself might be considered dated in sort of a typical media timeline. In a similar way, blogs such as journal blogs or health policy blogs like The Incidental Economist can actually serve to curate policy-relevant research and publish posts at these key windows of opportunity. It's also important to consider whether social media networks can build and sustain virtual relationships. We talked about relationships being key to evidence translation, and I think there's potential for that to happen through social media as well. So what I've shown on this slide, I've shown a retweet that a state legislator in Minnesota retweeted an article by Ezra Klein that was really data-rich and provided a lot of research evidence. And so I don't think that Kim Norton actually knows Ezra Klein, but this is an example of how there can be interactions over Twitter. I also am showing you a tweet that was mine when I responded to an article by Sarah Cliff and retweeted it, tagging my own research that had come out earlier, which then got retweeted and amplified. So finally, I think a promise of social media is that it can open up participation and dissemination beyond the traditional gatekeepers, such as journalists or academic presses or academic institutions, so that more researchers working in non-traditional settings, their intermediaries, advocates, community organizers, and decision makers and members of the community themselves can all be involved. However, it's important to emphasize that achieving this lofty promise of social media requires all of these people, these actors in the policy process, to actually use it and use it strategically. So researchers and the community members involved in research, as well as the end users or audiences, need to view it as a credible communication vehicle. We know credibility is an important component of research use and knowledge translation. Also, I just want to emphasize that it takes time to use social media well. There needs to be institutional support or other people to help leaders like you make full use of social media. And finally, if social media is going to be the connector that it promises to be, those conducting the research actually have to be connected by not too many degrees from the end users or audiences you want to reach. So if you or organization are only connected to friends, family, social contacts, it's unlikely that the city council member you want to influence is going to be aware of your message. So now I'll present some evidence from my own work that speaks to this first use of social media that I talked about, how social media could tap into existing networks. I'll talk about two studies. The first on how researchers themselves use social media to disseminate work, and the second on the other side, how policymakers might link to researchers, community leaders, and media as sources of information. So moving on to study 1, we conducted a survey with a random sample of health policy and health services researchers who attended the 2013 Academy Health annual research meeting to assess their use of and views of social media. In this study, we included an experimental vignette which described a researcher engaging in 3 different types of dissemination approaches: using traditional media, using social media, and doing direct outreach of contacting policymakers. And we found that there were significant differences among researchers' perceptions of use of social media, which they generally considered that they were less confident about, that they would respect an individual using social media less, that they would feel that this individual would get less credit toward academic promotion, and they had a lower overall impression of the researcher. And when we asked these researchers in the study directly about how effective they perceived different methods of communicating with policymakers to be, researchers were the least optimistic about the 3 social media modalities we included in the survey: Twitter, blogs, and Facebook. They rated these lower even than traditional research articles, and overall they said that reaching out to policymakers directly in policy engagement or getting work covered in the traditional news media was most effective. So overall, from this quantitative side of the study, we found that researchers did not have a very warm or encouraging view of the prospect of social media, at least in 2013 when the study was conducted, and we expect that's changing. They also raised 4 concerns in the open-ended qualitative section of the study, in which they talked about concerns about an unsupportive culture for social media, professional risk of using social media, low confidence in their own use of social media, such as that they didn't know how they could communicate the complexity of their work through social media, and in general that they were uncertain about how efficacious it would actually be if they spent the time investing in it. So certainly these concerns could have some backing to them, although I do believe it's changing. But that's why it's important to continue to study and evaluate how social media is or is not useful, and also provide support and training to those just starting out. So the same research team conducted a second study the following year, which was published in 2017, where we ascertained the names of 558 U.S. congressional staff who work on health-related committees or have health-related responsibilities in their members' offices. Of these, we were able to identify about 1/3 on Twitter, and then we analyzed the accounts of those 115 staffers whose accounts were public. We extracted over 30,000 handles followed by these 115 staff members in our sample. Then we restricted to those most likely to be influential who were followed by 3 or more staff, so they weren't simply analyzing people's individual friends or family members. Then we coded each entity followed into those that were professional, that is sort of related to health and policy work, or non-professional, which included food trucks and restaurants and bars and gyms. So the final sample that we analyzed was about 1,200 who we determined to be professional in nature. Of these, we then analyzed to determine the quantity or frequency that these information sources that these staffers were connected to were related to health or research. We were surprised to find that only about 5% were health-related. An even smaller number, 2%, were academics. And the majority were news media organizations, journalists, or political and government sources, of which most were elected officials. And most were individuals as compared to organizations. On this slide, I've shown the sources that were most followed by these congressional staffers on Twitter. As you can see, they're mainly political and media sources, emphasizing the importance of these types of institutions with established power in the knowledge translation process. And on this slide, I've shown the list of those who were most followed within that category, about 5%, that were health-related. I've highlighted in red those that were media sources. So even within the realm of these health-related entities, most are affiliated with media organizations, online media like Vox or Politico, or more traditional health media like the health desk of the New York Times. So the key finding from this analysis then is that these links with traditional media matter. If we want to connect, if we want our work to appear on the Twitter feed of congressional staffers, the best way may be to get this study in front of major journalists, since these staffers rarely had direct connections to health research community, whether in academic or in other settings, again, at least back in 2014. I want to turn now and talk about the other complementary use of social media to leverage the participatory nature of social media. Essentially, that anyone can use social media as a tool for community organizing and information sharing. And I'll talk about 2 ways it can be used. So we all probably know that social media is a powerful force in political campaigns, and at this point it's a major tool in all types of community organizing. If you're interested in more information about this, I recommend the book cited here, edited by Meredith Minkler, on community organizing and community building for health, which includes a dedicated chapter on using social media and online strategy. In short, the authors say that it's not about whether organizers should use social media for community building and advocacy, but when and how. And they describe the importance of having a social media strategy. It actually looks a little bit like the dissemination strategies you're planning in terms of the sequence of steps for your research projects. So first, social media users must identify their objectives. What's the objective of the use of social media? Is it promoting a neighborhood event? Is it disseminating information from a report? Or is it attracting attention from a journalist to garner media attention? The next step is to understand the audience. Follow the audience, like them on Facebook, get a sense of what they care about. The next step is to identify and craft the most salient messages that are targeted for that audience. Next, and fourth, is evaluating the impact, whether they hoped for effects were met using various types of social media analytics. And throughout, these authors argue for continuing to engage the desired audience through polite, consistent engagement and retweeting to cultivate a relationship with the audience. So I'll end now with describing a specific case of how social media has been used in grassroots organizing. What you see on the slide is the Mobile Voices, or VozMob project, which was a case of using social media in a participatory action research project. The Annenberg School for Communication at the University of Southern California, as well as collaborators from the Institute of Popular Education of Southern California and local stakeholders, got together to design a mobile phone platform for low-income immigrants in Los Angeles to illuminate their experiences and get their narratives and stories heard. The project goal was essentially just to let community members tell their own narratives of their social identity and connect with one another. It's no longer an active project, but you can check out the site archive, and there has been some research and evaluation of this project. So I want to conclude with one more powerful case. Social media was a huge force in advocacy efforts to prevent the repeal of the Affordable Care Act in the summer of 2017. As advocates, for instance, of kids with disabilities used Twitter to attract attention to their cause, such as the parent shown on this slide, Natalie Weaver. These advocates gained a huge amount of national attention through their strategic social media use, telling their stories, but also pairing their stories with research evidence on the benefits of health insurance programs and Medicaid. So this concludes this section of the course, which I hope has given you some ideas about how social media, and Twitter in particular, can be a skill you adopt for dissemination and your action goals in your projects. So finally, just as a concluding point, I think all 5 sections of this course come to the same point, which is a guiding principle that it's never too early to plan for dissemination and impact. Thank you so much for engaging with this IRL course, and do make sure to check out the resources and articles linked to the course as well. Thank you.